Hi, I'm John Lee. I'm a clinical informaticist who's very active in the Epic space. I'm a practicing emergency physician and also help my organization with their Epic implementation and also other organizations in my consulting practice. I have also been delving recently into some artificial intelligence and LLM tools, which I feel are highly underutilized and are ripe for exploitation. Healthcare operations are at this point really chaotic. And it's not just because we lack data, but because there's just so much of it in volume and varying quality. Semantics are opaque and hidden, and there's just tons of organizational noise. We've normalized things that take months, meetings, emails, governance churn, and we just assume that that's how healthcare should work. But there is an opportunity here, and that is to use LLMs and these artificial intelligence tools, which are highly accessible, but healthcare organizations aren't using them. Let me show you a real example. So in this case, we are taking multiple heparin protocols as we are merging a system, literally dozens of heparin protocols, and trying to make heads or tails of them. We certainly don't want to have multiple dozens of very similar heparin protocols floating around the system. It's a maintenance nightmare, and that level of complexity just adds to safety issues and also creates a lot of operational friction. So here's a Lovenox protocol. Here's an unfractionated heparin protocol. Here's a heparin protocol for DVT. All of these are from different hospitals within our system. We wanted to create a way to actually consolidate all of these into something that made sense, and also to take similar protocols and consolidate them into a single one. There aren't exact matches, but we know and recognize that they are close enough in content to have really substantial opportunities to consolidate. So the traditional way of approaching this is by taking a bunch of these protocols, handing them out as handouts or sending them out by email, having multiple email threads, having multiple meetings, heuristically figure out what's close and what's not. And that process would take literally weeks to months to sort out. So instead, you can take all of these protocols, all these documents, mostly PDFs, but actually a Word document as well, create a prompt that says, hey, you are a clinical pharmacist and hospital administrator. Say that you've inserted all of these files, do a comparative analysis, extract indications, compare dosing nomograms, identify conflicts, propose consolidation, and create a markdown table so that you can present this easily and put this into other tools to create further downstream content. And this sort of process, ingesting all this, abstracting it, heuristically thinking about it, would literally take weeks to months if you did it in a traditional way with multiple stakeholders, pharmacists, hospitalists, physicians, informaticists. Instead, you could have a single session like this. It goes through the process of assigning tags to different protocols. Then it figures out what the clinical indications are per file, does a detailed comparison of all the different nomograms, separates out the lower intensity and specialty service nomograms, which are different than some of the other standard nomograms. It does this without any specific prompting because it understands the underlying content. Figures out what are some of the conflicts and contraindications, and finally comes up with a consolidation proposal. I sat down with two pharmacists in a half an hour meeting and came up with this basic content that otherwise, again, would have taken weeks to months. And in this case, we came up with a protocol for high intensity, protocol B, which is a low intensity, primarily for cardiac reasons, and a specialty population and exceptions, for instance, with the neurology and neurosurgery. It then creates a practical merge plan. So this isn't the final answer, but what it does is it cuts off a huge chunk of that heuristic complexity with emails and meetings. That's a really, really painful process in healthcare operations, and cuts that down so that we can get just to actual decision making rather than coming up with the content that you need to make the decision making. That first part of and producing that consolidated content and that abstraction and synthesis takes so much time. And if you think about all the different types of processes where you have to come up with these sorts of insights, you can see the potential of this sort of process in using these AI tools to cut off a lot of the noise, a lot of the friction, and just get to decision making. If you think about all the different complexities that we deal with in healthcare operations, huge opportunity. And hardly anybody is using these tools in healthcare like this. All right, so this next example is an example of Claude as an operational AI chief of staff. And you can create a prompt that acts like a strategic consultant interview, and it costs your medical group nothing other than getting access to Claude. It's AI powered, takes 30 to 60 minutes. You answer a handful of questions about your operations, finances, and strategy, and the AI tool then analyzes your responses in real time, gives you feedback, compares you to benchmarks, and then creates a custom report, and then most importantly, creates a very thorough background context for you to then be able to interact and pitch ideas off of, like a virtual AI chief of staff. So you can see here the query response consists of a bunch of questions. First, tell me about your medical group, describe what your patient population is, what is your relationship to your larger health system, how do you acquire patients, what is your patient leakage situation, your digital presence, and so on. In this case, there are 18 questions. So if we then take this prompt and put it into Claude, what it will start doing is it will start asking you these questions. Now, I've actually created in a separate exercise a fake medical group in the Denver, Colorado area, and I'm going to answer these questions as if I was a chief operating officer of that organization. So in this case, it's asking me my medical group name, the number of physicians, primary specialties, and annual patient revenue. So I've have the answers. I'm going to paste that in, and I'm going to hit return, and it's going to then think about things and then give me a synthesis of the content that I've just given it. So it's saying that I'm a large, sophisticated multi-specialty group, top of 5 to 10%. Your 900 providers are substantial. Your APP ratio is notably higher than the national average. Your revenue per provider is about $778,000, and that's about in the middle range for your sort of multi-specialty group. So it's going through a lot of different things very, very quickly and giving you that sort of feedback that normally would take a lot of time and effort for you to gather. Now it's asking me about my patient population, payer mix, market share, and my competitors. So again, this is a fake medical group, but it is an abstraction of a lot of other medical groups that I've interacted with. So in this case, it's in the Denver metropolitan area. These are the counties. This is our payer mix, our market share, and our top competitors. So I'll put that in. So again, it comes up with a synthesis of who we are as an organization, gives a financial profile and some of the financial implications, gives you a summary of the metropolitan area, and some other strategic observations. So instead of boring you with answering all these questions, let me go to an actual query where I finished all 18 questions and give you an idea of what this sort of tool can do for you. So here, I've actually created a project within my Claude account called Community Medical Group, where I've done this sort of assessment. So as I load it up, you can see here's the prompt that I entered in. Tell me about your medical group, and you can see the answers that I put in. Just some highlights that shows some of the capabilities of the system. It actually asks some follow-up questions as it comes up with different insights. In which specific service lines do you believe you have the strongest market position? And that wasn't actually in the prompt, but the underlying context of what you wanted the prompt to do triggered the prompt to start asking these questions. In our case, I said our strongest service line is orthopedics. We have a strong collaborative relationship with a large cardiology group. They work tightly with our group, and 80% of their patients get the bulk of their other care within our group. It gives us some revenue information and then produces some revelations of what it calls a fascinating strategic picture. Orthopedics is your revenue engine, but it identifies cardiology as your strategic vulnerability. You have a $50 million dependency risk with this independent cardiology group. You have a strong patient sharing collaborative, but you don't control this relationship. So it has other query response conversations, more follow-up questions, and other insights. So this goes on, and you can see that it is quite extensive. So through this, it comes up with other very interesting insights. It says that we have a strategic value-based dilemma. You face a classic catch-22. To succeed in value-based care, you need to invest in care management, you need to invest in analytics and redesign compensation. This costs several $1 million in investment, but value-based care is only 18% of your revenue, and you can't justify $5 to $10 million, so you stayed at 18%, leaving a lot of money on the table. Meanwhile, the industry is shifting, and in 3 to 5 years, value-based care could be 40 to 60% of your revenue. If you don't invest now, you will fail on these long-term contracts, and your margin will collapse. So it gives you a bunch of strategic options: invest now for the future, maintain the status quo, or create a strategic partnership. It gives you a value-based care readiness scorecard, and in this case, you can see that this organization's overall value-based readiness is pretty poor. It gives you strategic input on what you should be doing to shore up your value-based infrastructure and strategy. And then also gives you a sequencing: fix the foundation, build value-based care capabilities, and in the third year, scale out your value-based care. And then it gives you immediate actions, medium-term actions, long-term actions, and gives you sort of the bottom line. And you can see that there's multiple questions, and this interactive back and forth gives you fantastic volumes of really rich, actionable information. So here's a question that is near and dear to my heart. There's a lot of organizations that are thinking about a third-party population health platform like Innovaccer or Arcadia, or if you're an Epic organization, going internal and using Epic Healthy Planet. So in this organization's particular case, they're using Arcadia. It is integrated with the EHR, but you're considering switching to Epic Healthy Planet. So it gives you all the different breakdowns of why you should stick with one or the other. It gives you the pros. Arcadia is best-in-class population analytics. It has multi-EHR aggregation, vendor specialization, and it's already implemented. But the cons are it's separate from Epic, it's an additional cost, you have integration challenges, and you are dependent on this other third-party vendor. Now, if you went with Epic Healthy Planet, it's fully integrated. There's no additional licensing costs. Promotes a lot of system standardization. Epic has a very strong commitment to population health and reduces IT complexity. The cons are it's less sophisticated. Its implementation will take effort. There's a lot of organizational change management, and then you are even more locked into Epic. So it goes through the decision framework for you and has recommendations that are conditional and says stay with Arcadia in this situation, switch to Healthy Planet under these situations. And then it ultimately responds to you and tells you you should switch to Epic Healthy Planet and gives you the reasons why. These are the sorts of decisions that often take enormous amounts of organizational effort and friction to come to some sort of conclusion. This doesn't necessarily make the decision for you, but this sort of approach makes the decision making easier because it summarizes so much information so quickly that a process in and of itself can consume 80 to 90% of the actual project effort. What this does is it cuts all that stuff out and it just presents the information to you so that you can actually make the decision. And here it gives you the implementation approach to Healthy Planet migration. So going on to a few more questions and the final synthesis. So it takes all this stuff, aggregates it, and synthesizes a very comprehensive report. It gives you an executive summary, overall operational health scorecard, Your financial performance is D minus, market position is C, operational excellence is D, value-based readiness is C plus, physician and workforce engagement is D, strategic positioning is C. So not that healthy of an organization, but it gives you your top strengths, your top vulnerabilities, does a synthesis of your competitive threats and your strategic opportunities. It gives you action plans for the first few weeks and synthesizes your success metrics. All of these things would just take enormous amounts of time and energy to come up with using the traditional healthcare operational processes. This takes literally about an hour. And so finally, it gives you a comprehensive improvement roadmap. Here's a 90-day action plan. And then going further out into months 4 and 6, months 7 to 12, 13 to 24, red flags and risk mitigation, and then goes through some of the risks and concerns that your organization potentially will have as they go through this process. Financial deterioration accelerates. What do you do in that situation? If you have a high physician turnover, or that the system refuses to invest in a lot of the key strategic investments. So then, based on this back and forth, it has now come up with some other questions for further exploration. And it gives you some immediate actions. And this is your summary. Community Metropolitan Health Medical Group faces a serious but solvable financial and operational crisis. It has a core diagnosis. It's not a cost problem. It's a revenue optimization and physician engagement problem. The path forward requires strategic investments in high ROI initiatives and not for further cost cutting. This requires executive courage, physician engagement, system support, disciplined execution, and a data-driven decision-making process. So it then creates a document that summarizes all of this sort of stuff that you can then now use and take into other LLM tools and use that as context for further decision-making. And then in this case, the point is that oftentimes the focus is on, hey, we need to make more money. But it's making clear that in this organization, that isn't the problem. It's that they are spending money poorly and they need to reallocate to strategic high ROI use cases. So after it's made this sort of assessment, we can then say, hey, we've talked about it amongst our group. We think our biggest opportunity is implementing a systematic no-show reduction program and improving access. We are struggling with pressures to reduce our operational costs. Our CFO will likely want us to cut somewhere else to fund the access improvement initiative. And you can ask the tool, now that it has this organizational background on you, to provide an assessment of the cost and the most effective places to add resources. And it goes through this process and it creates some highlights for your CFO and ultimately this document that goes through the cost benefit analysis and a strategic cost reallocation. Very detailed, and it gives information that is very specific to your organization or this organization and gives a net financial impact, the operating margin transformation, risk assessment, and an implementation roadmap. So all of these things are easily accessible using these sorts of tools right now. Here's my takeaway. There are tons of complexity that we've just accepted has to exist in healthcare. Healthcare is complex, our operations are complex, and we just accept that this has to persist. But it doesn't. The chaos, the endless meetings, the semantic confusion, most of that is tooling and framing of the problem and not a capability problem. The tools that I just showed you today are already easily accessible and ubiquitous. What's been missing is getting people to know how to use them as a true operational partner, as an AI chief of staff that removes complexity and accelerates the decision making. If you're interested in the techniques I've used or how these could apply to your organization, you can find me at hitpeakadvisors.com. I'll also be posting more videos like this focused on healthcare, Epic, and some of the operational realities that we all deal with on a daily basis. And if there's any questions you want answered, or if you want me to delve into a problem drop it in the comments or use the contact form on my website. Thank you for watching.